Joining me now is Milwaukee's Health Commissioner, Mike Totoraitis. Mike, really appreciate your time, you coming on to tell us more about this. What more do you know about the CDC's response and that assistance that you were denied?
It really was heart-wrenching to receive that email, and even as you were reading that quote, it got chills through my body thinking about that moment when I received the email from the CDC denying our request. This has been an ongoing issue in our city since January when our team uncovered the lead poisoning at one of our cities. It's pretty hard to put into words.
Yeah, and my understanding is it's from peeling paint, right? Can you tell us more about the discovery of that source? And can you explain why lead exposure is so dangerous, not only for the children there, but the staff members, the adults, everyone?
Yeah, so through our routine investigations of childhood lead poisonings that are reported to our department on an annual basis, we uncovered a child actually in one of our public schools, as you mentioned, who had been poisoned through the lead paint at the school. And through that investigation, we had subsequently found additional schools that had been had deteriorated lead paint and lead hazards and lead dust that actually put all of these students, the teachers, the staff, at risk for lead poisoning. And unfortunately, there were 4 children so far that have been identified as lead poisoned because of the schools. This has put us in a very difficult position, and hence our call to the CDC for additional support. Within public health across the country, when local health departments exceed their own capacity, they reach out to their partners, including the CDC, for additional support. And we were pretty disheartened after several months of working with them to have their entire team laid off.
Have any of these students, staff members, I have here hundreds of children, families, and school staff may have been exposed. What sort of health complications are you seeing from that, if any?
So, we are, given the number of students in the schools, we've been watching their health very closely. The school overall has around 68,000 students that are at all of the schools across the district, and over 100 schools were built before 1978. When lead paint was banned. So we've been watching both lead testing results very closely, trying to identify additional students. But this is really just the beginning. Even though we've been working on this since January, this crisis here in Milwaukee is growing in scale as we get into more schools and identify more lead hazards. Thankfully, we have not identified additional students to date. However, that's what the CDC was actually coming to Milwaukee, was to help us identify additional students and help ensure that we were prioritizing the correct schools and helping families with the right information so that they could watch out for potential lead poisoning. It's tricky to tell lead poisoning in a child. Generally, it exhibits different symptoms depending on the age of the child. However, the best way to know if a child has been lead poisoned is through a blood lead test, and that's what the CDC was actually coming to help us stand up more blood lead testing for the children here in Milwaukee. And we can't rely on them anymore and now have to rely on different partners to make that happen.
Right, and experts have said that there's no level, no amount of lead exposure that is considered safe. Health and Human Services Secretary Robert F. Kennedy Jr. said that the lead poisoning prevention and surveillance program might actually be reinstated and that the program staff should have never been fired. What do you say to that?
I really hope that that's actually the case. However, I heard that quote on the day that we received the denial from the CDC. So I'm at a loss, as every local health officer is across the country. The average size of every health department across the country is around 73 staff. So we have to rely on our partners at the federal government to respond to these emergencies. It's tricky to try to understand where we're going as a country when we can't rely on the top experts in our field. And as you mentioned, the lead team at the CDC were the best and brightest in the field around childhood lead poisoning. And they were the same group that had identified the lead poisoning potentially through applesauce last year. So we are in a difficult situation trying to understand who do we call now? Who do I reach out to nationally for the best advice and best support in these moments when we were expecting a small team to come to Milwaukee to help us in this moment, and now we can't rely on that.
Yeah, and you mentioned you're relying now on alternative partners, to do these blood tests and get a feeling of the impacts, the wide-scale potential impacts of all of this. I wish you good luck in this, sir. Mike Totoraitis, thank you.
Thank you.